And yeah, so let's have a Methodist to come over first. And we have Irene will help you do the slide. Okay, so if you just tell her the next, she can do it.
好，大家好，我们是从Houston Methodist Hospital 来的，然后这个是 Nairobi presenter， 然后这个是 John， 我们是从Medical Center Methodist， 然后 John is the Methodist Sugar Land， 相信很多你们大家都在 Sugar Land 就医的话 ，John is a good contact person。OK， 那I'm gonna give a microphone to Nairobi. So a lot of 很多这个东西我都已经先把它翻成中文了。那大家英文上的话，就先让他讲，然后我再帮大家做翻译，好吗 ？OK， 好。
Hi, good morning, everyone. Thank you, Yvonne, for the introduction. So, like she said, I'm Nairobi. I work as an oncology nurse navigator at Houston Methodist. And so today we're going to talk about Houston Methodist and the services that they provide and offer, and then also about my role specifically as an oncology nurse navigator at Houston Methodist. I specifically work in the medical center. All right, so what is an oncology nurse navigator? So as a navigator, we provide resources to mitigate barriers to care by guiding patients through the healthcare system, answering questions, educating, things like that, just helping you and empowering patients to make the best decisions for their care, while also helping them by providing resources so they can make it to their appointment, to whatever the need might be. Next. So like I mentioned, we help guide you through the healthcare system, providing education about your specific diagnosis and patient-specific diagnosis and treatment plan, and then coordinating healthcare for you. So if you're needing a specific specialty physician outside of oncology, connecting you with them, with those types of resources. Also outside of that, if you need social support, we provide assistance in that area as well. So we have navigation across the Houston Methodist system at all of our locations in the Medical Center, Baytown, Katy West, Sugarland, Clear Lake, the Willowbrook, and the Woodlands, okay? And there's navigators at every single Methodist location. So specifically in the medical center, the resources or the services that we provide in the medical center are cancer screenings. We have financial liaisons and counselors that can help with financial assistance, maybe if there's insurance coverage issues, and also connecting you with grants and funding based on your eligibility to help with the cost of copays or basic living expenses. And then we have global healthcare services in which this department handles all of our international patients. So you'll actually be partnered with a sort of case manager to help guide you through the health system. You can actually call global health services, and so you can talk to someone or make appointments in your preferred language. And then we have within the cancer center specifically, we have genetic counseling and our high risk program for patients who are may have like a family history of a particular type of cancer. You can kind of get ahead of it by knowing what evaluating your entire history and then finding out what next steps would be in terms of like surveillance, right? Maybe you need to get your scans done more frequently than what the guidelines state based on your genetic history. And then we also have nutrition and wellness. We have within there, we have a licensed oncology dietitian who meets with all of our patients and talks about health and nutrition. They offer, virtual education in terms of nutrition, health and nutrition. As well as acupuncture and massage therapy. This is open to all of the patients at Houston Methodist. Spiritual care, music therapy as well. And then here are photos and a list of all of the navigators located at Houston Methodist in the Medical Center. You can actually go on our website at Houston Methodist and see all of the navigators across the system and connect with them, but these are the ones listed at Houston Methodist. Myself, I cover gynecological cancers and colorectal cancers. Next. And then I'm going to hand it off to Joan so she can talk about the programs or services at Houston Methodist Sugar Land.
Thank you all for inviting me. I'm really excited to be here because we're down in Sugar Land and we're really close, and we have a very diverse community down in Sugar Land. One of the things, we have almost everything that Maine Methodist has, with the difference in that we're a smaller institution. So whereas navigation down in the medical center has a location in the outpatient building, we go everywhere on campus. So we may see patients in our cafeteria, pre-op, post-op, radiation therapy, infusion therapy. We also have IV therapy for non-cancer diagnosis. But we see patients in doctor's offices, and so we go a lot of different places. We have a lot of the same services. So music therapy, we have acupuncture and massage available. We have genetic counseling available. We also have a high-risk breast program. And then we have access to different things, what we call our survivorship program. So we have music therapy, art therapy provided by a certified art therapist and music therapist. Those are virtual meetings once a month, and along with that we have our what we call Life in Motion, which is a physical therapy. It's also virtual. We have a number of support services. So we have smoking cessation, which is offered quarterly. It's also virtual. And we actually will take anybody. You don't have to be a patient at Houston Methodist to partake in any of those services. We also have a general cancer support group, which is once a month. We have an ostomy support group, which is once a month. And we take patients from all over the city who have a new colostomy, urostomy, or ileostomy. We also have a breast cancer support group, and we have a high-risk breast cancer program that we do down in Sugar Land. The other thing is we're in Fort Bend County, so we're a little different than Harris County, which all of our other institutions are in that we have access to Fort Bend Access Health. We have Fort Bend Transit that can help patients with transportation. We also have access to translation services, whether it is in person, it can be through an iPad with a video, or it can be over the phone. So I may have people call me and I ask them what language they speak, and I can quickly dial in a translator to help me with that patient, even though I'm not bilingual in any way, shape, or form. The other thing is we have an annual cancer survivorship celebration. So right around the 1st of June every year, we host 300 survivors and family members to come in and celebrate the fact that they have lived through a diagnosis of cancer. And whether they're in active treatment or whether they're in survivorship, they're under surveillance, they are welcome to share their experience, and we provide them a meal and typically a vendor fare, as well as a lot of free goodies. We also have financial counselors and financial navigators who help screen patients for financial need, and we are able to then help you get those resources, whether we're going through a grant, whether we're accessing our Houston Methodist Charity Care Foundation program and monies to help pay for treatment. We know that more than 80% of patients with cancer will experience some financial stress as they go through treatment. And so it's really important for us to help you get access to that care, as well as to continue that care and not drop out because of financial issues. So we're always very happy to help in any way, shape, or form. The other thing we want to let you know is that I can't speak for Maine Methodist, but for Sugar Land, if you are being seen at any other institution, you're welcome to call our nurse navigators, and we are happy to help guide you in whatever direction you need to be. We've worked with patients who are coming from Puerto Rico, who've had family members, and because we're the most diverse county in the United States, actually, we do a lot of patients who come international, and so we have global services who also help us to access care and to help you sort through the financial burden of cancer and chemotherapy and treatment. Thank you for inviting me.
所以呢，我们今天
Oh, I'm sorry, let me tell you who our navigators are. Next. So I do thoracic, esophageal, and genitourinary cancers. We have Jennifer Serta, who does our gastrointestinal, as well as head and neck cancers. And then we have Rose, or Amalia, who does our breast and gynecological services. We also have a social worker, Scott, who works with us, a music therapist. So we do have a lot of services to offer. And one thing I didn't mention is lymphedema therapy. It's an after effect sometimes of different treatments for cancer, and we do have a lymphedema therapist on site, and that's what they specialize in. So they're very helpful for those patients who have swelling following cancer treatment. Thank you.
Alright, so 所以我们今天大家为什么会请了这么多的医院来的话，其实就是跟大家讲说你要怎么样寻找资源，你知道吗？因为有很多在这个 community 的人，很多人不知道我生病了我要去找谁。那我们会请像 Methodist 的话，我们请这个 Nurse Navigator。如果你真的什么都不知道的话，请可以联络我们。OK， 我们是 Medical Center， 它是 Sugarland 的。如果相信 Sugarland 的话，你们会比较住在 Sugarland 的人就可以去找 Joan。Joan is a very nice and kind person, and she will help anybody. OK， 那希望的，那这是给大家一个简介，就是有关 Methodist 他们有什么样的资源。那就是也告诉大家要好好利用资源。怎么样找资源的话，我们是 Nurse Navigator， 我们都可以帮助你们，好吗？这样有没有问题？等一下的话，我们会留在前面，然后我们准备了很多很好的东西给你们大家。如果你们还有什么问题的话，希望你们到前面来问我们问题，然后我们也会给你所有的 contact information。如果你们日后有谁有需要什么样的帮助，然后不管是国内国外的，那我们都可以帮你接这个线，好吗？好，谢谢各位大家。